Welcome back to the Digital Health Live studio at CES. My name is Jill Gilbert, and I'm very, very pleased to welcome a longtime friend and brilliant innovator, Dr. Bettina Experton, the CEO of Humetrix.
Thank you, Jill.
Thanks.
It's a privilege to be here, especially this year, under this gorgeous panel, 10-year decade of innovation you have put on stage. Thanks to you.
10th year at the Digital Health Summit this year, and we're really excited to have had you participate for years. So I think it's really important to share a little bit with people. Tell me about Humetrix and what you guys do in Blue Button and all of that. Can you share that?
Sure. So Humetrix, which I founded over 15 years ago, wants to put actual, actionable information in the hands of patient consumers. Humetrix is a physician-driven company, but our mission is to address major public personal safety, healthcare safety issue in giving patient consumers the information they need to better manage their healthcare. So we capitalize on all the technology available today, cloud-based data, non-identifiable information in the cloud, from which we put strong analytics, to mobile technology where you can bring that actionable information in the hands of patients.
So you're empowering what we've all been talking about since the beginning, empowering patients, giving them the data and the information and the history records that they need, correct? Is that
correct? And we can do that because with the need for transparency in our life and even more in healthcare, because it affects our well-being and our safety. Our government has led open data policy, one of them called Blue Button. This is what I wear on my lapel. This is people in Medicare, 53 million Americans. This is for veterans, people in the military, to easily and access their healthcare data online and make use of it. So the government turned to industry and say innovate around that policy, that program. And Humetrix has been the forefront to capitalize on this. And we won multiple industry innovation awards around the Blue Button program. And last year in 2018, we were the first native mobile application with Blue Button 8.0 approved by the Center for Medicare and Medicaid Services, Medicare, to have those type of application put in the hands of Medicare beneficiaries.
Wow. And is that what you're launching this year, or is that what you're announcing at CES?
We are launching, and we have launched yesterday.
Yeah.
Blue Button 8.0. So it's its major release. It's about 900 build of that application since 2012. But Blue Button 8.0 approved by Medicare, which imminently should publish those applications they have approved, so that those 53 million Medicare beneficiaries, their family caregiver, and their providers know about life and cost-saving technology. So Blue Button 8.0 takes the Medicare claim data, decode everything locally on your phone, translate that financial information into a actionable, longitudinal medical record. So the medication I am on, the history, the MRI I got 2 weeks ago, everything is there. And then we go one step further with 8.0. We build this strong data analytics engine, which in fact sits in the cloud, and use the de-identified data from the local storage of your record on your phone. And we output in real time, immediately, warnings, such as a drug interaction warning, such as a warning about the particular medication you have been prescribed, maybe an addicting drug like an opioid that you will not know about, and so forth.
Well, that's where the safety and precaution comes in, and the importance of these records making their way to the patient's own hands. So you had some exciting news come out of Washington this year. Bettina, you were very involved in legislation. Can you share a little bit about that? Because it's actually quite, it was a quite momentous moment. So maybe you can share that.
Well, thank you for asking, Jill. I think it was on your stage of the Digital Health Summit last year that I did announce, please stay tuned because something's happening in Congress. So I had the privilege to testify before the Energy and Commerce Committee of the House of Representatives a couple of years ago. And members of Congress, specifically Representative Susan Brooks from Indiana, asked me to help her draft a piece of legislation so that this life-saving, cost-saving type of mobile application could be put in the hands of patients who need it the most,
Right.
patients in Medicare or Medicaid. So I helped Susan Brooks' staff draft that legislation. It's a bipartisan bill, and it was introduced in the House in December, on December 12th. Last year, it's called the Mobile Health Record Act, and with a new Congress...
Mobile Health Record Act.
Correct. And bipartisan bill, and the co-sponsor is Yvette Clarke, with a Democratic representative from the state of New York, and it's going to be reintroduced in the next few days with the new Congress.
Fantastic. Well, congratulations on all of your accomplishments this year. It sounds like 2019 is going to be great for you, and it's a pleasure knowing you.
Thank you, Jill, and it's going to be great for millions of patients. That's all what we care about at Humetrix. Thank you, Jill.
Well, thank you all for stopping by the Digital Health Live studio at CES. Signing off today, Jill.